The next question is a ligament that connects the tibia to the fibula on the front of the ankle. So this would be on the front of the ankle, the ATFL, anterior tib-fib ligament. Anterior tibiofibular ligament. Medial tibial stress syndrome is also known as, MTSS is also known as, and that's down with our injuries. We talked about how it is often called medial tibial stress syndrome is called shin splints. The pain is here. Shin splints is a syndrome, is a list of symptoms or a compilation of symptoms that are in a certain area. So these would be pain here. We could have pain here on the outside, but often on the inside of the tibia. A ligament that connects the calcaneus to the fibula. And let's go back all the way up to where we do the anatomy. Oops. Here we go, this one. So we've got a ton of ligaments here. We're not expecting you to know all of them. We're just talking about a few of the most common ones. So this is the ligament that connects the calcaneus to the fibula. So let's go through and see which one connects the calcaneus to the fibula. All right, here we go. Calcaneus to the fibula. It's the calcaneofibular ligament right here. It is on the outside side. So you remember, inversion is the most common ankle sprain, and so these ligaments here on the outside are going to be the more common ligaments to sprain. What is the return to play timeline for an athlete that has had an ACL reconstruction? So if we go to the knee and we find ACL, I believe we have a return to play. Here's our return to play timeline. And that timeline is 6 to 9 months, maybe even 9 to 12 months. Or if you're Coach Soren's, a lot longer, we'll say. Next question is, the blank prevents the tibia from moving posteriorly. So what ligament keeps the tibia, this bone here, from moving posteriorly? And that would be the PCL, keeps the tibia from moving posteriorly. The ACL keeps it from moving forward. PCL keeps it from shifting backwards. Which of the following is a symptom of a meniscus tear? So in our knee notes, we're going to go, the meniscus was before ACL. We talked about the terrible triad. Do we have? All right, meniscus tear. Some red flags for a meniscus tear: swelling, pain, popping, locking, grinding, or giving way of the knee joint. There's a couple of tests, the Thessaly test, the McMurray test. We did the test in class where we stood on one foot, we bent our knee, and then we rotated from side to side. That is a meniscus test that you can do, that we did without a training room. Next question is, the lateral collateral ligament sprain can occur with a blow to the medial side. So let's talk about this for a second. Here's our knee. This is our fibula. So we know this is the LCL, or lateral side. We know that this is the MCL, or the medial side here. So we have MCL and LCL, medial collateral ligament and lateral collateral ligament. So the question here is, a lateral collateral ligament sprain can occur with a blow to the medial side. So a strain, a pull, or a stretch, or a tear is going to, can I set this down here? There we go. A blow to the inside, is that going to stretch the outside, the LCL ligaments here? Yes, it is. A blow to the outside is going to stretch, like if a football player gets rolled up on, a lineman gets rolled up on, and puts pressure on the outside here, more likely to tear MCL and ACL. So which of the following was a symptom of the meniscus tear? Locking of the knee, because this meniscus is what's on the test. If a flap or part of this meniscus gets caught in here, then the knee won't be allowed to move. You won't be able to move it. It'll lock in place. The symptoms of patellar tendonitis are very similar to what syndrome? We talked about fat pad syndrome. It's not something we see in young athletes very often. Fatty pad syndrome occurs when people work on their knees, like plumbers. I think it's on this next There we go. Fat pad syndrome. Plumbers or maybe people that work in the airlines that are packing the luggage underneath in the cargo hold there. But it is below the patellar tendon. So we have the patellar tendon here. Your fat pad sits right in here. So that could be easily confused with patellar tendonitis. Signs and symptoms of osteoarthritis. We spent some time talking about osteoarthritis of the knee, which osteoarthritis can happen in any of our joints, but we talked about the knee here. Pain that increases with activity. The knee is stiff, an antalgic gait, so you're limping basically due to pain. Chronic swelling, joint tenderness, osteophyte formation, joint space narrowing. I think we had some pictures of joint space narrowing. Loss of range of motion, that crepitus, the sounds, the grinding, the popping, the crackling. We decided it was creaking and not squeaking. So here's some more osteoarthritis. Treatment for osteoarthritis, there's platelet-rich plasma, PRP injections. We have microfracture we talked about. We talked about MACI. We talked about OATS and OCA procedures. Watched a video. All right. And the next one is an injury situation. A male cross-country runner complained of pain in the medial arch and heel that tended to move centrally as the week progressed. He complained of severe pain when rising in the morning and sitting for a long period of time. The area appeared slightly swollen and severe sharp pain along the bottom of the foot in the medial aspect of the calcaneus. Pain increased with weight-bearing activity. So we talked in our foot, ankle, and lower leg portion. We talked about a ligamus band that is on the bottom of your foot, which is the plantar side. So this would be most likely plantar fasciitis. And that red flag was the rising in the morning. I think we have red flag somewhere. Here's a red flag. When they get out of bed or if they've sat for a while, when we rest our foot, it kind of plantar flexes. And so when they get up and they try to stretch it, they put their foot flat down on the ground. That tries to stretch that ligamentous band, that plantar fascia, and it doesn't feel good. A meniscectomy, what is a meniscectomy? It is a treatment option for a meniscus tear. It's Mr. Snow talked about that, pay me now or pay me later. A meniscus tear, you might be able to go in and just have it removed with a meniscectomy, and they might be able to smooth it out, and you go on your way and you get back to your sport very quickly. But sometimes that's not always the best option. You need your meniscus. You're going to want your meniscus later on in life. So if they can repair it, a repair is going to be a better option. But a meniscectomy is where they go in and they snip out part of it to try to smooth the meniscus down so you don't have pain and it doesn't lock or catch. Bone-to-bone ACL graft options. We talked about graft options. We talked about autograft and allografts. Autografts are grafts that they take from your own body. And one of the options was patellar tendon autograft. And ACL is way back at the beginning. I'm not sure. I don't think I have a slide with just the graft options on it. Yep, we do. So autografts, patellar tendon, that's this. So what they do, they cut out the center 1/3 of the patellar tendon, and then this grows back together. I don't know if they suture back together. I think in the video they said that. So here's a picture of taking that middle third of the patellar tendon out. And they can also use a hamstring autograft, and that's semitendinosus. You can see an example here where it wraps around the front. That's semitendinosus, and they can triple that or quadruple that to make an ACL. And the ACL would be thread from the tibia up here and attached into the femur. Quadricep tendon, so the top portion here is the quadricep tendon. You can pull part of the quadricep tendon to make an ACL as well. I've heard of Achilles tendon, not commonly used unless the other options have been used. I had a patellar tendon autograft for my first ACL. The second ACL they made out of hamstring tendon. Allograft, they also use cadaver people that are deceased. They use different tendons for ACLs repairs as well. Arthroplasty. Arthroplasty is a total knee replacement. And I'll scroll, I know that's at the very end of our knee unit. But arthroplasty is simply, they're taking off, they're putting, went too far. I don't see it right off, but arthroplasty is where they're taking off, they're resurfacing the end of your femur, the distal end of your femur, and the proximal end of the tibia, and they're putting metal and plastic parts in. The next one, plant and turn, and it's a matching, so you would say that's the most common mechanism of injury for an ACL tear. An autograft is a grafted tissue from one point to another in the same individual's body. An allograft, a tissue graft from a donor of the same species as the recipient, but not genetically identical. You don't have to take anti-rejection drugs or anything like that to get an allograft. Next question. We're nearing the end here. Actually, this is the last one. This is another situation scenario for you. Write the name of the injury below each description. Injury situation. A football player injures his big toe during practice. The signs and symptoms, there is significant pain and swelling in and around the first metatarsal phalangeal joint. Pain is increased when the athlete tries to toe off, and certainly during running and jumping activities. Looks like I froze there, but you don't need to see me anyway. So that is going to be turf toe. Turf toe is what that is. All right, so test Thursday, Friday this week. It's tomorrow and the next day. We're wrapping up the semester. If you have any questions, there will be a Zoom here in about 10 minutes that Mr. Snow and I will be available to answer your questions. Also, I'm available on email. Good luck on your test.